Hi everyone, this is Chad Steele with my video clip for the educational implications of having ADD or ADHD. So to begin, just let you know what ADD and ADHD are. Those are attention deficit disorder and attention deficit hyperactivity disorder. And those are psychological disorders which are uh, at the most basic level, they're characterized by having problems paying attention, and in the case of ADHD, it's the possibility of a hyperactivity. So, and the educational implications of those are that students diagnosed with ADD or ADHD may struggle in school and have some problems. Uh, the journal, for example, the Journal of Pediatric Psychology published an article on the academic and educational outcomes of children with ADHD, and that found that children with the diagnosis had poor grades, reading, and math standardized test scores, and also had increased grade retention. That the article went on and on. They also have higher rates of detention, expulsion, lower graduation rates, and lower rates of secondary education, which all sounds pretty doomy and gloomy, but that may not be the case. Uh, there are some problems with the connection between ADHD and poor grades, like low income, factors like low income, boys, the fact that boys are 3 times more likely to be diagnosed than girls, and access to health care, when those are taken into account, show that the ADHD diagnosis is not as effective in determining poor grades. And that connection was shown by a number of people, including the National Bureau of Economic Research, who found that the effect of ADHD on educational outcomes was not as well connected to poor academic performance. And what they found was that poverty was a much more significant factor in academic achievement. And a lot of that research is coming out of Canada. So what's a student to do if they have ADHD and still need to go to school? Seems like there's two big options that parents and students face that educators need to be aware of, and that's to medicate or to not medicate. Now, both of these choices are complicated, by a culture of the war on drugs and things like that, to tell parents, of course, you don't want to give your kids drugs, but well, let's just see how they work. To begin with, ADHD medications do work. 67% of parents with children that have ADHD found that medication was the most helpful treatment. That's according to a Consumer Reports Health Survey. We also have the Journal of Pediatric Psychology, which I cited earlier. It says that medication is effective in reducing the symptoms of ADHD, and it does increase their academic productivity, but unfortunately does not increase their standardized test score or the likelihood of graduating. And finally, the National Institute of Mental Health, which has a lot of resources on ADHD medication, says that medication works, but that there's no one drug that works for everyone, so that they do need to try different ones to see what works for them. So say you are opposed to drugs, you don't find a drug that works for you or your child, what can you do? Well, the American Psychological Association has an article from Rebecca Clay that offers a variety of non-pharmacological methods for treating children with ADHD. The two big main ones, which I'll touch on, are behavioral interventions. There's a lot more information and not enough time to go into them, which basically say, they're focused around parents and teachers really focusing on a child's successes rather than dwelling on their behavioral issues. And it's just a brief overview. They also really stress lifestyle changes, especially more exercise and much more sleep, which they have found to be effective. Again, they didn't have a lot of data showing on their educational outcomes for these two interventions, and they stated that these were very difficult. So thanks for listening to my video clip about the educational outcomes of implications of having ADHD. My name is Chad Steele. Have a great day. Nope. Might stop this someday.